All right, folks. I am really excited about today's conversation because I'm all buckled in and ready to learn a lot because I literally know very little about this topic of plant-based therapy. And I know I probably botched that, but use of cannabis, hemp, and other plant-based therapy treatments for older adults. And we are going to learn from two of the leading experts in the nation on this topic, who are very familiar with both plant-based therapy and older adults. Today, I've got Sherri and Elisabeth. And before we dive into this, let's get to know the two of you a little bit better and how you got into this unique career path, and then we'll dive into what everything we need to know uh, on this topic.
Awesome. Well, thank you, Steve, for the introduction and for the invitation to come and share our work with your audience. We're nurses. I'll go first. So I'm Elisabeth. I've been an RN for the past 38 years. Spent my first decade in hospitals and then another 20 years inside insurance companies managing operation and sales. But what happened to me is I crashed my bicycle, went out on leave to have some shoulder surgery. And when I was at my chiropractor's office and part of the healing process, I was introduced to CBD and cannabis as a medicine. And it was through a topical massage, actually. After the adjustment, she says, "Why don't you have Denise work out your shoulder and get you back to that pre-surgical arm faster?" And I said, "Okay." So I didn't know I was getting cannabis on me until I smelled something funny. And I said, "What is this?" And she said, "It's cannabis." And I said, "Well, what's that going to do?" She goes, "Well, it's going to reduce your inflammation, reduce your pain, help you. If you continue to use it, you can get a topical to go, and it'll get you back to that arm faster and help you with physical therapy, etc." So I said, "Okay, sign me up and tell me more." And I went to the library on the way home, checked out all the books I could on cannabis, and started to read it because nobody ever told me that CBD and cannabis was a true medicine. And I was taking a lot of ibuprofen, 2,400 milligrams a day at that point, Motrin, Flexeril, muscle relaxants, and I wasn't necessarily feeling better. And once I started to take the CBD, I said, "Wow, this is amazing. I don't need as much of the pharmaceuticals." And that was my gateway to healing. And once I discovered I could heal myself, I said, I need to help others. And so over a period of time, started a company and developed, coaching one-on-one on how to help people adopt and optimize the use of this. Wrote
And
that
you've
book.
actually written a book on this topic.
I did. I actually wrote the book, Cannabis for Health, Become a Coach. And that book has become our programs where we're training healthcare professionals as well as patients on targeted learning modules, and developing an ecosystem. So, I'm all in at this point.
I I love it.
Yeah.
Yeah, and well, my story is a little bit different, but very similar. So I was in Massachusetts. Gosh, my name is Nurse Sherri, and I've been a registered nurse for 37 years this year. Came from the big teaching hospitals in Boston, worked at all the big teaching hospitals. But in 2012, I found myself on the other side of the bed, sick and suffering. I was in the intensive care unit, very sick. Came home, I wasn't getting better, and I was on what they call the pill and procedure journey, with multiple pharmaceuticals, multiple pills, multiple procedures, and nothing was getting better. And it was actually a 70-year-old nurse that introduced me to cannabis as medicine. Her name was Mary Ann. She came to my house with her harvest from her garden. She was actually growing the plant and making topicals and edibles, and had all kinds of goodies for me in the basket. And I just said, "Mary Ann, how could this possibly work for me when nothing else has?" And she said, "Sherri, you need to get with the program. Cannabis has been around for thousands of years." She says that prior to 1937, cannabis was in the US pharmacopoeia. It was approved by the American Medical Association. And my father was actually a pharmacist that carried it in his pharmacy. And then she disclosed to me something very secret and sacred, which actually helped open up my eyes. She said, "Sherri, I want to let you know something. I've been using cannabis every day since the age of 17, and I'm not on any pharmaceuticals, and I've never been hospitalized." And I had to take a look at that because in that particular point in time, I was what they call circling the drain of despair. I was on over 18 different pharmaceuticals, not getting better. And so her plant formulations came into my life and actually started to work. And I was able to wean off of all of those pharmaceuticals. And just like Elisabeth did, if I heal myself, I have to help others heal as well. So I
Wow.
started the Green Nurse, and we ended up merging our companies in 2021. And now we're Holistic Caring and the Green Nurse, which is a company, educational company, coaching, consulting, helping people to have better days using plant medicine.
Man, I love this. Your backgrounds are amazing that you came from the traditional structure of formal medicine and training as nurses, but your unique paths led you to discover the alternative, and now you're helping others. And I have to say, like, I'm guilty of somebody who's incredibly nervous about using plant-based therapy because, like, I, my experience with this was in my college dorm room, and I couldn't handle it 40 years ago. And all I read is that it's too powerful now, and and all this crazy stuff. And so what I love is that you're coaches, and that somebody doesn't need to go down this journey on their own, that they've got somebody that they can call and consult with in addition to, in or providing direction to whoever's behind the counter at the place that you purchased this from.
Well, yeah,
So
and that is the reason we do what we do, because we want, seniors and all of us, from pediatrics to geriatrics and everything in between. Everybody needs to be able to understand this and to use it at their own level. And you're right, the cannabis that is in the dispensaries is the 10 to 30% stronger than it used to be when we were, having it in the 80s, etc. And boomers are like, oh, I can smoke pot. I've done that, before. And it is very different, because the cannabis used to be 5 to 10% THC, and now it's 35% THC. So we have to give people that the scale of relativity and how to approach this so that they can stay safe and have an effective experience, because we don't want them to say, I'll never do that again. I went to the shop and I'll never do that again. We help people to avoid that, and saving them time and money, because we can shorten that experimentation period of how do I get this into my system in a way that works for me, and that's what we specialize in.
And I can give a story just to that example. So my
oh, I
mother
love
was
it.
anti-cannabis. She literally blocked me on Facebook, wrote me out of her will for 2 years. Meanwhile, I'm getting better. I'm thriving, starting a business, living my best life. And so I took care of a nun who was actually on fentanyl patches. And she had chronic regional pain syndrome. She was 70 years old in a lot of pain. I helped her wean off of the fentanyl patches using cannabinoids and hemp-derived CBD products. She came on my podcast to share her compelling story of healing. And I said, Sister Suzanne, with all due respect, my mother is very Irish, very Catholic, very strict. She thinks it's the devil's lettuce. And she's like, it is not the devil's lettuce. It is the Lord's kale. And I said, with all due respect, Sister Suzanne, what would Jesus say about all this cannabis? And she held up her finger and she said, Sherri, Jesus would say, what the frig did it take you so long to use this God-given plant that I created for you? It would be a sin not to use it. So I took that clip and sent it to my mother. And a couple of weeks later, she called me up and she says, okay, I'm ready. What's the gateway? And so I worked with my mother. I worked with her. It took about 6 months to get her comfortable, but we started off with a topical. So topical application of cannabinoids, just using CBD on the skin. It doesn't get into the bloodstream. We have receptors in our skin. So she was using that and she says, wow, that's amazing. It could be better though, couldn't it? I'm like, yeah, it could be better. Let's try the next thing. Let's try a little bit of oil. So we used broad spectrum CBD, which is whole plant, 0 THC. She started to take that, use the topical. She started to see even more benefits. And she says, okay, I think I'm ready for the THC. So we started her on a full spectrum CBD product. which has a trace amount of THC. It's legal on all 50 states. You know, my mother wanted to make sure she was abiding by the law, and she was. And so she started on this and she started to feel better. And she was like, wow, this is amazing. And then she says, now I want to try the chocolate that I see you have. Can you send me a chocolate bar? And so I sent her a chocolate bar to try. And I said, you know, you just want to take one square. That's it. Just one square of the chocolate, not anymore. If you get into trouble, give me a call. You can use the CBD if you start to feel a little bit too elevated. She didn't call me right away. I didn't hear from her the next day right away. So I decided to call her up and I said, hey, Mom, how did it go last night? You know, you had a chocolate square. She goes, well, I didn't listen. I had 3 chocolate squares.
Ooh.
And I said, ooh, that's a little bit too much. And she goes, yeah, I know, but it was wonderful. She said it was wonderful. I'll never do that again. But now what I know what it feels like to have that on board. And so, and she says, and I'm using cannabis as medicine right now and I'm not high. And I said, okay, Mom, what does it mean to use cannabis as medicine and not be high? And her answer to me was, the pains become background noise. I'm not as grumpy. I'm sleeping a lot better. I have less inflammation in my body and I'm not so depressed about all my problems.
Yay.
And her relationship with her daughter was repaired. Best
And I'm
of
written
all.
back into the will.
Yeah.
Yeah,
Yeah.
that's
She's
great.
She talks to her mom all the time.
All the time. Yeah.
That's great. Okay. Well, now I'm I know a little bit about this, but not very much. And so I'd love to kind of like back up on 2 key things that I know I'm confused about, and probably other people are too. And that's CBD and THC. Give me the overview. Like, I mean, I think the THC, that's what we all think about when we're getting high. But tell me a little bit about these, or back it up and give us the elementary lesson on plant-based therapy.
Okay,
Right.
so when the plant grows wild in nature, it's going to have a mix of CBD and THC. There's the cannabinoids and there's terpenes and there's flavonoids. All of those are the components, and most of them are found in the trichome. So when you see the pictures of marijuana, cannabis on the, you
Hemp
see the
flowers.
buds. The buds are where the medicine is. So you always want medicine with that component as opposed to just the leaves and the stalks. But so then you break that down chemically, and you'll see CBD and THC, and the good plants have them in equal proportion or something close to that. But what's happened today is that they're breeding them to either grow high in CBD or high in THC, and really not a whole lot in between. There are some older strains that are like Harlequin, where it is more of a 1-to-1 type of balance, but generally it's CBD or THC. And CBD is really sort of what I call the medical miracle. This is something that we found to be very anti-inflammatory. It's a neuroprotectant, helping to bathe the central nervous system and the brain to prevent decay and to have restorative properties in the brain and the memory, etc. It can be anti-anxiety. It helps activate our serotonin channels. It helps us with inflammation throughout our entire body as an anti-inflammatory and an antioxidant. And it can help us with our aches and pains, skin issues, anything that's inflamed, even the gut. Sometimes when we think about, our digestive system, CBD can be balancing. It sort of modulates all of our other systems back to a restorative set point that is called homeostasis, where our body is just working as it should, and we feel good. We're balanced. Every once in a while, I talk to an older adult that has no pain, that isn't anxious, that is sleeping well, and I'm like, wow, that is a dream, right? But most of us struggle a little bit, and CBD can help us nuance back to health. THC, which Sherri will cover, is the other side.
Yeah, well, I'm going to cover a little bit more too,
Okay.
just a little bit. So the difference, so you have the cannabis and the hemp plant. And the difference between the two is the amount of THC that's found in the product. So cannabis has more than 0.3% THC. Hemp has less than 0.3% THC and more of the minor cannabinoids that we see in the formulations that we actually make at Bloom Hemp CBD.
Yep.
So the THC molecule is a molecule, so it's a cannabinoid. It is the molecule that interacts with cannabinoid 1 and cannabinoid 2 receptors of the endocannabinoid system in the body. So this is really can be kind of overwhelming because it's a lot of information, but I'm going to try to break it down. And the reason why it works so well in the body is the plant makes a molecule called THC. We make a molecule in our body called anandamide. The THC molecule and the anandamide molecule have the exact same molecular shape, and they plug into the receptor the exact same way.
So you're hardwired for this plant.
So the THC molecule is 10 times stronger than the anandamide molecule, or another way of saying that, the anandamide molecule is 1/10 the strength of the THC molecule. So you don't need a lot of THC in order for this to activate receptors. Because when we make anandamide upon demand, it's just a millisecond. We have enzymes that create it, enzymes that break it down. It plugs into the receptor, initiates a biological complex to tell the body to either do something or not do something, and then it gets broken down. So the endocannabinoid system is the system that works with cannabinoids. And cannabinoids are molecules that interact with this system. There's 3 types of cannabinoids. Endo we make, phytocannabinoids the plant makes, and then synthetic cannabinoids that the pharmaceutical companies make.
Yeah.
And they don't talk about that. But there are synthetic cannabinoids that do exist.
Yeah, and the endocannabinoid system is that regulatory system, and it's sensing and watching for what's off balance in our body at all times. So that's why when we take in these compounds, we can it can work for so many different things. Whatever's going wrong, it could be a headache, it could be indigestion, it could be pain in my knee. It's going to be helping wherever it's needed because there are imbalances. And when you get them into the systemic circulation, they're going to float around the body looking for receptors that are saying, hey, I'm open, give me the ball. And that plugs in, and then it can bring us back to balance.
I have another example that's going to help make it
great.
Very clear. So just imagine your body is an umbrella. Okay. So all of the spokes of the umbrella are your different organ systems, right? Your cardiovascular system, respiratory system, integumentary system, genitourinary system, reproductive system, immune system, just to give example, central nervous system, pulmonary system. Then the fabric pieces that attach to the spokes of the umbrella are all of the neurotransmitter signaling systems. So think of dopamine signaling, serotonin signaling, opioid signaling. We've got TRPV1 signaling, hormonal signaling. So the endocannabinoid system blankets on top of our entire umbrella because we have cannabinoid receptors on all of the cell surfaces of all of our 11 organ systems. And we have cannabinoid receptors at the neurotransmitter signaling junction sites. So just imagine, go back to the umbrella. That's who you are. It shows the interconnectedness of the body. You take this plant, full spectrum cannabis with multi-compounds, showers on top of the umbrella to bring homeostasis to all 11 organ systems, our immune system, and all the neurotransmitters, all at the exact same time. So that's what Elisabeth calls the pleiotropic nature of this plant, right? Working on multiple different physiological systems all at the same time.
Yeah.
Wow. All right. This is, I can tell that you both have a medical background. It's amazing. But I think I caught a fair amount of that and understand the power of plant-based medicine. So now let's move towards older adults. And maybe you can share with me, I mean, we had the story of your mom, which I totally understand, but I guess, we've got somebody, whether it's, an individual listening to this or somebody who's concerned about mom or dad. What are some situations that you've encountered with older adults that might help us best understand how to utilize this type of therapy?
Well, everybody, pain, sleep, appetite, digestion, stress, anxiety, all of those things, sort of escalate as we age. And we're looking for something to alleviate it, to give us a better day. And the pharmaceuticals are, really where people pivot because they go to the doctor, they don't feel good, and they get a pill. So what does that pill do? It's pharmacology. You put that into your stomach, it digests, it goes through the liver, and then it travels throughout the body, and it's activating specific receptors with specific cause and effect. And the phytocannabinoids do that with CB1, CB2, and these other receptors in the body on a much more natural, nuanced, gentle way, because it's not just hitting one specific doorbell. It's sort of looking around and saying, "Hey, how can I be of service?" It really is like that. So seniors and older adults want to use something that's more natural. A lot of people are saying, "I want to take botanicals and supplements instead of pharmaceuticals," and we get people on lists of supplements too. But this is something that you need to learn a little bit about, right? Because you need the difference between CBD and THC. THC, you need guardrails. CBD, you can take a little bit more liberally because it doesn't intoxicate or get you high. But beyond that, then seniors also need to know the different routes of administration, right? And how to take a tincture versus a capsule or a gummy versus inhalation if you want to take a puff off a vape pen, versus using topicals, sublingual strips, etc. So there's different routes of administration, what we call that. And that gives people a flexible toolkit. You can have the inhalation and the sublingual drops for something that's a little bit more immediate, and also that interacts less with pharmaceuticals. Or you can have something more sustained release, which is the gummies and the capsules, and you can have that for your long acting. So there's short acting and long acting. And it's people that, let's just take chronic pain, because a lot of people, 1 out of 4 people, adults just over 18, have chronic pain. It's not just older adults. We're all struggling, and there's a lot of people that are taking opioids, if you can even get them anymore. Most doctors don't even prescribe them, and we get people saying, "Hey, Elisabeth, I can't get my opiates anymore. I'm really in trouble. I need this to work for me." And that's where we go to work, and we give them different formulations for different times of day, different levels of pain, and a way to sustain them so that we can help them find their freedom. But really, it's about knowing that this is an option. It's a natural option, and then you have to learn a little bit about it. It's not as simple as just going to the counter and getting the gummies, because we all know somebody that had a 10 milligram gummy or a 20 milligram gummy, and they had a horrible experience. But that's the starting point for the bud tender, and they don't guide people correctly.
Yeah.
So.
And then what's important to people as they age, right? You think about it. They want their independence. They want their cognition. They want their memory. They want to have agency. They want to live their best lives. They want to enjoy their golden years, not having to rely on a pharmacy, a pill, a procedure. And this gives people a lot of freedom to truly live their best lives at the end of their life, as they get older.
And one of the best things is when you're taking CBD on a daily basis, and I do want to highlight daily basis, because THC you can use more sporadically in small doses. So going back to that gummy, 10 milligrams, you need to cut that into at least quarters. Sometimes take a 5 milligram gummy and cut that into quarters. So you're only getting a milligram or 2 as a starting dose, because the psychoactive threshold is somewhere between 1 to 2 to 3 milligrams. Any more than that, then you start to feel some of those changes in the mind, the emotions, the memory, the cognition, etc. And THC is like that, but you adapt to it with tolerance. So the more you do it, the less you feel that, right? So, but with CBD, it's safe to start. And what we try to get people to do is take CBD on a daily basis to sort of get this blanket working again, to shower their umbrella so they have a better set point, and then to use THC in small doses to get them a little bit further down the road. But CBD is something that can take time, and people need patience, right? So a month to 3 months and daily dosing is really what we advise people to do. It's not something that you can take just once. That, like a CBD topical for the knee, sure, that can help right away. And you can notice that, especially if it's really well made, and quality does matter immensely in this work. But with the drops or CBD capsules, you really do want to give it a couple of months, because you didn't get all inflamed overnight, and it's not going to undo on a natural basis overnight either.
Wow. Okay. Well, one thing that I am absolutely positive of, like all of the different forms that we can take this in, the correct dosage, the details that you all clearly are have a deep understanding. I would be very nervous about doing this on my own, reading a book, watching YouTube. Okay, hey, I'm going to do this. The value of having a coach alongside you to see if this is a good treatment and to make sure that you're administering it correctly, and that is so important. So I want to share my screen because I've got the website for, I believe this is your coaching business,
Yeah. Yep. If
holisticcaring.com.
you click on the
Okay.
patients tab,
So Holistic Caring and the Green Nurse is our educational, coaching, and consulting business. So we offer a lot. We have patient consultations, patient programs. We tend to both patients and professionals. So we have a little something for everyone. So on the patient side, it's patient programs that Elisabeth has written, as well as the coaching visits that we actually have. We have a different four different levels of coaching packages that are available.
Oh, and I love how you say, because as you were talking about this, I like how you refer to this as a care plan, because that's really the vibe that I was getting when I was listening to you, is that, wow, this is like, I would feel comfortable doing this if I had you guys on my team drawing up a care plan for me. Um, and and I guess but also, like I said earlier, it's sort of like you've even got self-guided options
right.
too for people.
Yeah,
Something
and
for everyone.
and then if you click on the senior plans, you can open that up, and this is a really nice page because it spells out exactly what we do, right? It assuages their fears, helps them understand that. That's a video that we did at the Aging Life Care Associates 2 years ago down in San Diego. Cannabis, CBD, and dementia and neuroprotective. How does that work in the brain? And then helping clients live their best lives wherever they are, as well as their care managers and their family. This is a little case study of Lorraine, who had dementia symptoms. She had advanced Alzheimer's, actually. And I worked with her and the family and the care facility to help her wean off the Seroquel, which is, what the daughter's first goal was. My mother's on something with a black box warning and it scares me. I don't want her on this. And they're starting, morphine, and they've got antidepressants, etc. And we were able to wean her off most of her pharmaceuticals. She didn't stay on hospice. We transitioned her out off hospice. She was hugging people. She was loving again. She wasn't crying out. She was starting to toilet again, asking to go to the bathroom. It was almost just shocking how much we were able to restore her function, and she lived another 2 years. And if you scroll down, you can keep going. And then this goes into the nursing process, right? For $250, if you just, right there. Right.
Sorry.
Yeah. So it right there. Okay, perfect. So, what we do is start with an assessment, right? We go through all the pharmaceuticals, the medical conditions, past histories, surgeries, etc., where's that client is right now. And then we instruct them about CBD and how it works in the body. We help them shop in online markets, and hemp is almost all sold online. And then THC, we go to either Weed Maps or Leafly, and we can dial in how to shop at a dispensary, what to buy, how to take it. And then we create a dosing plan, which is the initial titration, right? How do we get you started? What do you take? How many milligrams? What route of administration? How do you time it with the other pharmaceuticals? And then we continue to work with them. And this includes a month of guidance. So follow up. So the care manager can call us, the family can call us. And then follow-up care, I'm not sure why that's crossed out, but it's just $75 a visit. And we're just running this business ourselves. We have other nurses on the team, but it's not covered by insurance. People always ask, do you take Medicare? No. But many people can use HSA funds and that sort of thing to pay for it. But it's really, we're worth our weight in gold. I tell people, because this makes this option doable, and it takes away all the fear and fumbling of doing it the wrong way.
Yeah, and the other thing too is that we're registered nurses that actually have clinical experience
And everything else
with patients
Yeah.
in the hospital. So we understand pharmacology. We understand, I recently took care of a hospice patient over the past 6 days who just died today. And I was coaching the family on how to use the pharmaceuticals with the cannabinoids together to give him a better death at the end of life.
And even to understand the pharmaceuticals better, because the hospice nurse wasn't, doing the best. But
so, teaching them how to even use at the end of life, what's appropriate at what time, and dosing and bringing in plants so he could stay at home and he could be surrounded by his family and have his loved ones there. It was a beautiful interaction. It was sad and heavy, but you know what? He had a really good death. Surrounded by his family, he was at peace. He didn't suffer, and he had the right amount of cannabinoids and pharmaceuticals at the same time.
Man, it's interesting that you brought that up, because I just recently had a discussion with a nationally renowned end-of-life expert who shared with us what was in his advanced care planning documents. And one of the things that he said, in my documentation, if I'm in pain at end of life, I want you to use plant-based therapy like cannabis and whiskey. He's like, I don't use it now in my life, but if I'm in pain at end of life and it can be a solution, I would like to utilize that. And I thought that was it's funny you brought that up, because I thought that was very insightful. I thought it was a nice statement.
A wise gentleman and doctor for sure. Yeah, and we'd love to collaborate. I mean, that's somebody that's right up our alley. And not a lot of people get this, and that's why we are at the pinnacle of doing the right things with the right reasons for the right people, with the right approach. And it's also why we had to purchase Bloom Hemp. We were working with an Australian firm for a while until they ran out of funding. Building a global clinic in Australia, the UK, Canada, Jamaica, different places. And when we parted ways with them, we're like, what are we going to do? Because we had CBD there. But then we turned around and bought Bloom Hemp. It was for sale at the time. And we've made this our own. We have tinctures and topicals, soft gels, gummies, isolates. And if you scroll down a little further, you'll see that there's a free nurse line. And nobody else is doing this. People can call the nurse line, talk to us or our pharmacist who answers the phone also during the day, ask about different products, dosing, is this right for me, etc. And then on the services tab, we have a free care plan. So somebody can fill out a quick intake form. If you click the menu button, then you click services, perfect. Then this is a first door for people to come in and fill out this little brief intake, and it comes directly to us, and we reply generally within 24 hours with a detailed care plan of, okay, this is what you've got going on. Here are some recommendations on different tinctures, topicals, gummies, soft gels, etc. And this is how to take it together with the pharmaceuticals that you put on your list, as well as how to talk to your doctor about this, etc. And we try to meet people where they are. If they need to use THC because they have advanced pain or advanced cancer and they really want to go in on that, then we can have a holistic caring appointment. But most of the time we manage people on the free care plan, and they buy products from Bloom Hemp, which helps us. That one little image you saw there, the ecosystem, and I love that. It's the nurse, the doctor, the treatment team, the resource materials, the coaching, the CBD shop, the THC, the medical cards. We do it all. I spent 19 years in insurance companies, and I call this my cannabis HMO because that's how we're running it. There's no drop balls. We hand things off and work with other providers and care managers. We love working with care managers. Oh my God, they bring us a patient, and then they love working with us too.
Well, that's how we met, is through, we're both partners with the Aging Life Care Association. And yeah, when I met you all, I was like, holy cow. I mean, this is really serving a void in the marketplace that I think is not necessarily helping this plant-based therapy. Like, as you all described all the nuances, it really made me more nervous about using this without guidance and coaching that you all are providing. And you can see how, uh, I mean, and I can see ways where I might want to try utilizing some of this therapy, but there's no way I wouldn't do it without your all's guidance.
Yeah.
Um,
That's great.
Man.
AARP did a survey, and over 10% of people over 50 are using cannabis as a therapeutic option right now today. And a lot of them have, fumbled their way to the door, but they're doing it. They're taking gummies, they're using inhalation, they're smoking pot. Some people are used to it. Maybe they never stopped. And they're just aging in, like Marianne, who didn't take any pharmaceuticals and has never been hospitalized at 70 years old, smoking a little bit of cannabis every single day. And that just goes to show you where we started the show with, talking
Mhm.
about how these compounds bring us back to balance. And the more that your body stays in balance, the less it goes off balance. So that's why, it's something that's not just episodic, like, you take oxy for 3 weeks after surgery. Now, cannabis is something that you can learn to make a lifetime companion, but it doesn't need to cost a lot of money. It doesn't take a lot of time to learn. And once people get it, they're very, very thankful that they have it. And you can't put the train back in the station, right? Cannabis is legal in 40 US states for medicine. 25 as an adult use recreational access where you don't even need a prescription or recommendation from your doctor to use it. And so we're helping people to be able to use this. And again, going back to the care managers, some of our favorite calls are from somebody that says, I've got somebody with severe pain, somebody with advanced cancer, somebody with dementia, which we work a lot with. And cannabis can be, just like I talked about Lorraine, but getting people off of some of the antipsychotics that are very harmful to the body and just dope them up. It's a chemical restraint. You give grandma some Seroquel 3 times a day, and you're not going to have her up. But guess what? She's easier to manage. But isn't there a better way? Yes,
Mhm.
there is. There is.
Man. Wow. I'm like, it's like drinking from a fire hose talking to the two of you, but I feel 150% better for our older adults and just people in general, knowing that there's coaches, the two of you, that can help on this journey. That makes a huge difference, and it's missing in this wacky ecosystem that we're dealing with. It's this is amazing. Well, I know we
Well,
talked about it a lot.
I do have
Okay, you
one
got.
thing. Yeah, and this is for all the nurses that are watching.
Yeah.
So if there's nurses that are out there watching, I want you to know that we just didn't pull this out of our hats, right?
Yeah.
Cannabis nursing has been recognized as a specialty. Back in 2018, the National Council State Boards of Nursing, which is the Nursing Regulatory Board, published a 64-page document in the Journal of Nursing Regulation that stated that all nurses, nursing students, and nurse practitioners must have 6 essential areas of knowledge when it comes to cannabis as medicine. Then in 2020, Cannabis, a Handbook for Nurses, was published by Dr. Carrie Clark. I authored chapter 9, co-authored it, called The Cannabis Nurse Experience. This is the first cannabis nursing textbook. Elisabeth's book has then come out, Cannabis for Health, Become a Coach, came out the same year. And then finally, Cannabis nursing was recognized as a specialty by the American Nurses Association in 2023. So the American Nurses Association represents 5 million nurses. So someday nurses are going to be able to sit and get board certified. Last year, they published this book called Cannabis Nursing Scope and Standards. We are actually written about in this book, Holistic Caring and the Green Nurse, and Elisabeth's book is written in this book as being able to teach to that level. So we uphold the scope and standards of cannabis nursing.
Yeah, and our Cannabis Nurse Health Coach program is a 30 unit, 3 modules, 10 units each, 30 continuing education units for nurses, and a year-long mastermind on how to do clinical and business development to add this to your practice. So we're not doing this just for us. We're trying to train, it's like, how do you prepare people to have dinner forever? You teach them how to fish. That's what we're doing.
I love this. You're truly changing this and creating an ecosystem that's going to make this people feel more comfortable about this line of treatment. It's long overdue, and I'm so excited to have interviewed you and to be sharing this resource with the positive aging community. Folks, I'm going to make sure that all the links that you can get in touch with both Sherri and Elisabeth and their organizations are going to be down below. But this is just the first of the interviews with y'all because there's so many rabbit holes we could go down, as well as I would love to have perhaps like one of your clients on sharing how they're using it. I think that would be wonderful as well.
Yeah,
Yeah,
absolutely.
We do have a few clients that would be open to that. Some of them, once they've healed, they become very, they want to share their
They're an
story,
advocate.
and they're an advocate.
Yeah.
And so, yeah,
Yeah,
that would be
this is
good.
great. All right.
Thank you.
Well, till the next time, this was really amazing conversation. Thanks so much.
Thank you again.
Thanks.
God bless.